In 1869, a photographer was commissioned to document the patients of Rainhill Asylum, just outside Liverpool. The resulting plates were intended for a medical catalogue, a visual reference of diagnoses, treatments, and institutional conditions. Most of these photographs show what you would expect: gaunt faces, restrained hands, the hollow architecture of a Victorian lunatic asylum. But one plate, catalogued as Plate 37, is different. It shows a young woman seated upright in a wooden chair, dressed in the standard gray linen of the asylum. Her hands rest in her lap. Her posture is rigid, almost ceremonial, and her mouth has been stitched shut. Not metaphorically, not symbolically. The photograph clearly shows coarse black thread, pulled through the skin of her upper and lower lips in a crude, uneven cross-stitch pattern. This is the image you are looking at right now. The asylum records identify her only as Patient E. Ward. Admitted March 12, 1869. Age listed as approximately 22 years. Diagnosis, and I am quoting the original intake ledger, persistent hysterical vocalizations. That phrase. Persistent hysterical vocalizations. It appears 3 times in her file, once at intake, once in a treatment log dated April, and once more in a document we will return to shortly. But first, let us stay with the photograph. Look at the composition. The woman sits centered in the frame. The lighting falls from the upper left, consistent with the window placement in Rainhill's East Wing examination room, which other photographs from the same series confirm. Behind her, a plain plaster wall. No decoration. No other figures. Her eyes are open. They are focused directly on the lens. There is no visible sedation, no slackness in the facial muscles around the brow or cheeks. She appears entirely conscious. And then there is the mouth. The stitching is visible even at this resolution. 5 distinct puncture points along the upper lip, 4 along the lower. The thread appears dark, likely waxed surgical catgut or common sail thread, both of which were available in institutional medical stores of the period. The skin around the punctures shows slight swelling, but no active bleeding, which suggests the stitching was not performed moments before the photograph was taken. It had been there for some time. Now, Pass 2. In 1967, a batch of Rainhill Asylum's administrative documents was transferred to the Lancashire County Archive during a routine institutional clearance. Among them was a leather-bound folio labeled Ward Superintendent's Observations, covering the years 1868 to 1871. On page 114, there is an entry dated April the 29th, 1869. It is written in the hand of Dr. Horace Pembury, the ward superintendent assigned to the women's chronic block. The entry reads, and again I am quoting directly, Patient E. Ward continues to produce vocalizations of an unprecedented nature. The sounds do not conform to any recognized language, nor to the patterns of glossolalia observed in comparable cases. Staff have reported considerable distress. Nurse Aldous has twice requested reassignment. The decision has been taken, with the agreement of Dr. Fenton, to apply a mechanical intervention to the oral cavity to prevent further disruption to the ward. Mechanical intervention to the oral cavity. Look at the image again. That phrase, mechanical intervention, is the clinical language Dr. Pembury used to describe what you see in this photograph. Thread, pulled through living tissue, to silence a woman whose voice disturbed the staff. The entry does not describe the stitching procedure itself. It does not name who performed it. It does not record whether patient E. Ward was sedated, restrained, or conscious during the act. It simply notes the decision and moves on to the next patient. But the file does not end there. Pass 3. In the same folio, 7 pages later, there is a second entry concerning patient E. Ward. This one is dated May the 15th, 1869, roughly 2 weeks after the first. The handwriting is notably different. It is hurried. The ink is pressed harder into the page. 2 words are scratched out and rewritten. Dr. Pembury writes, "The intervention has not produced the desired result. Patient E. Ward's vocalizations have resumed despite the closure of the mouth. The sounds now appear to emanate from the throat or chest cavity without the involvement of the lips or tongue." Nurse Aldous confirms this observation independently. "I have no precedent for this in the medical literature and have written to Dr. Fenton requesting a secondary consultation." Let that settle for a moment. The mouth was stitched shut, the stitching held, and the sounds continued, not muffled, not diminished. Pembury specifically notes that the lips and tongue were not involved. The sound bypassed them entirely. Now look at the photograph one more time. The stitched mouth, the rigid posture, the eyes, focused and unblinking, fixed on the camera lens. Knowing what Pembury documented, that the stitching failed to stop the sound. This image takes on a different quality. This is not a photograph of a woman who has been silenced. This is a photograph of a woman whose mouth was sealed shut and who kept speaking anyway. There is one final detail. The Lancashire Archive contains a supplementary index of Rainhill's photographic plates, compiled in 1903 by an administrative clerk during a records audit. Each plate is listed with a brief description. Plate 37's entry reads, "Female patient, seated. Oral suture visible. Exposure satisfactory. Plate undamaged." Beneath this, in different ink, possibly added later, a single annotation. Sound present during exposure. Photographic exposures at Rainhill in 1869 required the subject to remain motionless for several seconds. The room would have been quiet, the photographer would have been close, and someone, the photographer, the clerk, or a later archivist, felt compelled to note that during the taking of this very image, a sound was present, from a woman whose mouth was stitched shut. The image you are looking at is the only known photograph of patient E. Ward. No discharge record exists. No death certificate has been located in the Rainhill files. Her real name, if E. Ward is indeed a pseudonym, has never been identified. Dr. Pembury's journal contains no further entries about her after May 1869. She simply stops appearing in the record. But the photograph remains. The gray linen, the wooden chair, the rigid hands, the eyes, staring directly into the lens with something that does not look like distress, and the mouth, stitched shut. 5 punctures above, 4 below. Dark thread, pulled tight. The question that the Rainhill Archive cannot answer, the question that Pembury's journal raises but never resolves, is simple. If the stitching did not stop the sound, what exactly was making it? If you have a theory, or if you have encountered similar annotations in other Victorian asylum records, leave it below.